So welcome to the first MIM Shorts. This is a weekly event that we're going to start showing some of the topics that we're going to talk about in Malta. So I'm going to start first, and then Tom will talk a bit about his his presentation. For mine, I've got to share a window. I will be speaking on improvised medicine. So there's going to be a 2 hour workshop with myself and a bunch of other people talking about March and PFC on the different things that we can use for improvised medicine techniques, starting with improvised tourniquets, which I think is the most important improvised skill anyone should learn to use. And we are going to have QR codes on the table so they can scan the PubMed articles that we are referring to as we teach you these skills. And we will let you know if we are teaching something that hasn't been. There are some things like Dennis Jurema has sent us some stuff on hypothermia that hasn't been tested yet that we need to do some studies to double that up. But the whole premise of my 2 hours is no lectures, hands-on, and we are going to be talking about just ways that you can support your austere clinic with improvised stuff. So splints and um, improvised hematocrit is one of my favorite. Is spinning hematocrit using capillary tubes, and everything will be based off of the CAVC or the March algorithm as we see it here. And it will we have a whole bunch of equipment to burn through, and we will be seeing what you guys could. I learn more from teaching this, in all fairness, than I do than my students, because my students will come up with sorry, it's a conference, so the delegates will come up with pretty amazing ways of doing something I never thought about. So I'm selfish on offering this, and it's because I learn different ways of some of them work, some of them don't. But so that is my workshop that we're going to have during the conference on the 2nd of February, and I will hand this over to Tom to talk about his workshop.
Yeah, so these are the workshops we're presenting at our conference in Malta, which is definitely worth checking out. We're going to put a link, all our social media will have a link to that conference. And fortunately, we are running these workshops one after another. So you don't even have to choose. You're not going to have to miss out on one to attend another one. So we're going to have Abrick running the improvised medicine. We're going to have prolonged field care, which really nicely kind of leads on from that. We're going to have expedition dentistry, and then we're going to have me popping in with austere and pre-hospital ultrasound. So the benefit is, if you're coming along to the conference, you can attend all of those, or you can pick and choose, but you're not going to be excluded from one because you've chosen the other one, which personally I think is always really frustrating when you attend a conference. So I get what I think is the best workshop, which is why I got it, which is great. So I got austere and pre-hospital ultrasound workshop. The challenge I got with that is it's an hour and a half workshop. So we're hoping that's long enough for delegates to get hands-on. We're going to have a number of different point-of-care ultrasound machines. So I have a bias for the Butterfly IQ. I use that in my clinical practice, and I think it has a lot of features, making it really versatile and useful in the pre-hospital and austere environment. But having said that, we have a range of other devices, and I'm not sponsored by anyone else, so we don't have any free devices. So we're gonna use those variety of devices. We've got an hour and a half for delegates, and usually on our APUS course, our austere and pre-hospital ultrasound course, the main focus is to drill down to make sure everyone is competent undertaking the EFAST. So that's the extended focused assessment of sonography and trauma, or abdominal sonography and trauma. Because we found that the people that attend our courses, the core thing they want is, how do they integrate point of care ultrasound into their trauma assessment? You kind of really front end, essentially part of your primary care, for your primary survey, if you can. So So we will be covering that in our workshop. We'll hopefully get everyone up to speed with what an EFAST exam is with ultrasound, and we'll get you hands-on doing that. The challenge is we then want to really, populate the rest of that time with some of the prolonged field care stuff, some of the other stuff that's really useful application of ultrasound that we risk glossing over if we only focused on the EFAST, the trauma applications. So within that hour and a half, we'll try and get you set up with using ultrasound in trauma. And then we'll also try and bring in things like using ultrasound to detect long bone fractures, using ultrasound to identify and pinpoint foreign bodies. Because as we know, no one wants to go digging around for a splinter or a foreign body. But if you can visualize it and localize it, that's half your job done. We'll use it in discussion of gaining intravascular access. I know, like loads of you guys, if you're pre-hospital, if you're austere, your patient's cold, they're shut down. Maybe you've only got one limb to work with because the others are injured or inaccessible. So having ultrasound as a tool to guarantee, hopefully, intravascular access is really powerful. So we're going to cram all of that into an hour and a half and get people hands-on. So again, like Abrix, ours is a hands-on session. This is really getting people scanning, and then hopefully we'll get to try some of the kind of the fancy and emerging uses of ultrasound. So on our APUS course, our austere and pre-hospital ultrasound course, we use ultrasound for measuring optic nerve sheath diameter, which is a fairly good proxy for intracranial pressure. So we're well aware that when you're austere, when you're pre-hospital, you don't probably have a CT machine in your van, but you could easily have an ultrasound machine. And that measure of intracranial pressure, or that proxy measure, can then be useful in terms of triage decisions. Who goes to which hospital, who goes first if you've got limited extrication or options. So the plan is to give you a hands-on hour and a half with a number of different ultrasound probes so that you can see for yourself the pros and cons of those different probes. Clearly, they all come with different price points. They all come with different limitations in terms of image quality, battery length, how you charge them. These are the important things for us, aren't they? So you'll get to play with all the probes. We'll get you hands-on scanning people and then scanning some phantoms, because it's slightly unethical to actually stab foreign bodies into our volunteers. So we'll work around that. But that's the plan. So an hour and a half crammed hands-on ultrasound practice. Clearly, if you wanted a bit more of that, we run at our 2-day APUS course with pre-learning and then post consolidation learning. So that's probably closer to a level 1 ultrasound qualification. But hopefully this workshop will at least ignite that fire. It'll ask the question what ultrasound could or could not do in your practice. And hopefully we'll try our best to link ultrasound to prolonged field care, to extrication, to some of these other things. I haven't found a way to link ultrasound to expedition dentistry yet, but that can be on our list for things to achieve. I'm sure there's an application. You must be able to have a look around for abscesses and things. So that's the short overview of the hour and a half pre-hospital austere ultrasound session that we're running at our conference in Malta. And Abrix will tell me if I've missed things or I need to tell you anything else.
It's basically going to be a lot of fun playing with various ways you can use ultrasound. But for the next couple minutes, we wanted to open this up for questions. If any of you guys have any questions about the conference or anything else within the college.
Just a short question, Abrix. How long is your workshop of the improvised?
It's 2 hours. I thought there were 2 hours, all of them. Tom, don't you have 2 hours for APUS?
I think on the last program I was slightly limited, but to be fair, I think I'm last in the day, so I think I can.
We can make that 2 hours.
We can probably hang around and keep scanning until we run out of ultrasound gel, and we usually bring liters of ultrasound gel.
5 liter box. Yeah. So it'll be 2 hours for it.
Yeah.
Not quite enough for our 5-day PFC course that we do, but at least get a taster.